To News at Noon, everyone. I'm Troy Thompson. Joining me today, of course, is Dr. Eric Smith from Georgetown Bariatrics and Advanced Surgical Services. Welcome to the show, my friend.
Thanks for having me.
Nice to see you. Well, we have finally come to do another show takeover, which is great. Now, we've had some incredible success stories from your clinic, but today I'm super excited because we're talking about men. And we have two men that are coming in a little bit later on, Chris and another Eric.
Yeah.
But I wanted to ask you, first of all, the men sitting at home right now that feel that this weight loss journey is more for women rather than men when it comes to surgery.
Well, we see a lot more women than men nationally for weight loss surgery.
Yes.
I think probably because we're a little bit more stubborn. I can say that because I'm one of them. But no, I think, you know, it's just difficult sometimes as a male when you're battling with weight issues. Many times you're the provider, you have a lot on your plate with your family and your job, and sometimes you're the last person to take time for yourself. And to reach out for help is a struggle for people sometimes, to admit that they need help. And
I was about to touch on that because we know, and we've talked a lot, that men don't face up to their medical issues, correct?
yeah, we're not good patients.
Yeah.
We can summarize it that way. Yeah, we tend to ignore things. Like I said, we tend to focus on our family, the people we're providing for, our job, and all the roles that we have, and sometimes we come last.
Is it easier for men to drop those big numbers than it is for women? Especially with their hormones and things like that?
You know, if you look at the statistics, there's not a massive discrepancy.
Right.
But I would say, anecdotally, and the two men you're going to meet today, by no means do I want to say they don't put a lot of hard work in, they do.
Yeah.
But our makeup is different. Many times men are more apt to be involved in fitness and strength training, which is something that I think women overlook. Strength training is very important in strengthening the bones and starting to not only remodel your body, but get rid of the fat and build muscle, which muscle burns more fat. And so it changes your metabolism. So when men kind of get in that pattern and they see that success, yeah, we see them do really well.
Big numbers. And I was about to say to you, I feel that men, when they decide to put themselves on the line and do this, they're not at home looking after the kids, working and doing all the housework that women do. So they seem to be the more success with the weight loss journey that I see.
Yeah, I mean, in the end, anybody that wants to be compliant with the instruction that we give them, they can do very well, and men are no exception for that.
Talk to me a little bit about when it comes to their medications and surgery. Is it the same for women, same type of surgeries for men as it is for women? You decide which is the best angle to go? Yeah,
absolutely. We give them the same choices. You know, men tend to be, we're meat and potatoes kind of people, you know? we want to feel full. And we sometimes don't have maybe the sweet addiction or some of those, not maybe like a lot of the women do.
Yeah.
We do, but we maybe just not as much. And so we just want to feel full. And so a lot of times our surgeries work really well for them because they're like, I'll eat whatever you tell me to eat. I just don't want to feel empty throughout the day.
Well, Chris was just telling me off camera that he was a sweet guy.
All right, way to make me look bad. All right.
And I was thinking, I'm a cheese guy. I like all the cheeses and all those sorts of things.
Right.
But I do understand that I believe that when men put their mind to it, that they feel that they can accomplish it. It seems to be mentally easier for them. And that's the conversation I've had with men who have had this surgery before.
Yeah, I definitely think it's like anybody. Anybody that's very goal-driven will be very successful. Yeah. And I think when they make that commitment and say, look, I'm all in, then we see them do really well.
I think it's fantastic. Well, we appreciate everything you're going to do with us today. You know, coming up after the break, you're going to meet Chris, an incredible success story. We'll be back after this short break. Welcome to News at Noon, everyone. I'm Troy Thompson. Joining me in the studio again today is Dr. Eric Smith, and one of his success stories from Georgetown Bariatrics and Advanced Surgical Services is Chris. Welcome to the show, buddy.
Thanks for having me.
Nice to see you, and what an incredible success story. I just want to remind everyone, you started 13 months ago at 337 pounds.
Well, at 360, yes, that's correct. But 360 when I first started this whole thing.
Oh my gosh, well, I'm sorry I just blew out.
No, that's
25
okay.
pounds.
That's okay.
This morning you hopped on the scales.
208.
208, 13 months in the work. When you hear these sort of, these sort of numbers, that's pretty impressive, Dr. Eric.
No, it's very impressive. It makes me feel good.
It does. Well,
Yeah.
we know you're number one.
Makes me happy for them. It's very rewarding. He's worked really hard.
And something that Chris said to me off camera was that this wasn't truly about him getting off medications because he had high blood pressure, diabetes, or all the things that we normally talk about, Dr. Eric. This was about him waking up one morning and going, I want to be with my kids.
Right.
This is about living.
Sure.
Is this the conversation that you have with the guys that come into the clinic?
Yeah, I mean, that it's not uncommon for people to just realize if I don't change something, I'm not going to live as long as I'm supposed to. If you look at mortality rates for people when their BMI gets above 35, which is when they qualify for surgery, they go up exponentially.
Yeah.
So at the end of the day, if an intervention doesn't happen to change that, most people aren't going to live to be the age that they were supposed to.
Well, while we're talking, we're looking at all your before and after shots, and I have to say, Chris, when you woke up, what was the day that you woke up and went, enough is enough? What was that turning point for you?
I don't know that, I've been big my entire life.
Right.
And so I don't know that it was a day. I knew that there was a day. There'd been many of times, like, I'm tired of this. I'd go on a diet and I'd gain it all back, and it was just back and forth. But when it started where I didn't want to get out of bed in the morning, couldn't physically, it was hard for me. And I've got an 8-year-old at home, so it became really important when he started playing sports and he wanted me to coach him, and where I couldn't function and do the things that I wanted to do daily. I couldn't go in the front yard and play with him as much as I wanted to or much as he wanted me to. So that's probably when it became the most real to me.
Something that Dr. Eric and I often talk about is, I say, do they stick to their meals and the food and the conversation of the training that happens after your surgery? How have you found that with the team of Dr. Eric's?
Well, that's the great thing. It's very comprehensive. If I'm struggling with something, I can make a phone call and they help me through it.
Yeah.
As far as we were talking off to the side, I had 3 days where I struggled in recovery. It was after the surgery, 3 days after. I'm laying there. You wouldn't believe how many pizza commercials are on TV. You notice stuff like that. I'm telling you, it's different. And I literally remember laying there and saying, what did I just do to myself?
Right.
And I told you would.
Yeah, that's right. No, you did.
Really?
And you'll have those times, 100%. But after those 3 days, I'll be, well, maybe 4, 5. And once I started back to work and got into a schedule, there's been
What
no one
surgery
back.
did you have?
The gastric bypass.
Explain to everyone
gastric
very
sleeve.
he had the
I'm
gastric
sorry.
sleeve.
The vertical
Gastric
sleeve. Yeah.
Just explain to everyone very quickly, because we're putting up the B-roll of that gastric
Sure.
sleeve.
Yeah, so it's basically a restrictive procedure where we remove a large part of the stomach.
Yeah.
We don't change absorption, and the stomach now looks like the shape of a banana, and the capacity is reduced about to 1/8 or 1/10 of normal.
How long did the surgery take to be done?
His was probably on average of about 45 minutes.
And I was probably within less than an hour after surgery, I was up walking in the hospital.
Yeah.
When did you go home?
The next day.
The next day? So, this is the sort of thing that you can say you could have done on a Monday, take the week off, and then build yourself up to go back to work the following Monday,
Mine
right?
happened to be on a Tuesday. I took the rest of the week off, and I was back to work the next Monday.
Wow.
Yeah.
Well, what an incredible success. I truly appreciate you coming in.
Anybody wants to hear about it,
Isn't his team the best?
it is. I mean, it's so comprehensive, and it's top to bottom, front to back, anything and everything you want to know. They're supportive. If something, you're doubting it, you're questioning it, because I've known some people that have done that, and they're there for you.
Well, Chris, we really appreciate it. We'll be back after this short break. Welcome back to News at Noon. I'm Troy Thompson. Today is the show Takeover with Dr. Eric Smith from Georgetown Bariatrics and Advanced Surgical Services. And we're talking all about men and their incredible weight loss. I want to introduce you to an incredible man called Eric. Nice to see you. The two Erics on the show. Thank you both. What an incredible success story. Tell everyone at home what weight you were when you first started this
I was
program.
356 pounds when I first started.
356,
356.
and you have lost how much in total now?
145. I'm 209 right now.
149?
145 pounds.
145 pounds. Eric, Dr. Eric, I should say. Sorry about that. I keep saying men show big numbers.
They do. And unfortunately, we tend to get to big numbers when we battle with our weight. So we've got a lot of weight to lose if we put the work in. And that's exactly what he did. He's worked really hard at it.
What operation did you choose to have,
Had the
Eric?
gastric sleeve.
Now, was there a particular reason why we went gastric sleeve?
No, I mean, we present all the options to them in the seminar like we would anybody else. I think, if I'm not mistaken, Eric had type 2 diabetes, which sleeve has been shown to be very effective for that,
Right.
and some other medical issues as well. And then that's the one he chose.
What made you want to go through this?
So I had a watershed moment. I went out with my teenage son, went to the roller coaster park to ride some roller coasters, and I couldn't fit.
Wow.
Yeah, so I came home and made the hard decision that it was time to make some changes. Looked at it logically. I said, you know, if I've struggled my whole life to lose 50 pounds and I've never kept it off, what makes me think I can lose 100 pounds or 100 pounds plus?
Did you try to lose weight?
Sure, I've always tried to lose weight, absolutely. The typical things people do, you know, you do the diets and all that kind of stuff. There's so many yo-yo diets, but it was a hard stop.
What was your weakness in food?
I'm a late night eater,
Oh, me
right?
too.
So it's crackers and cheese or it's something like that. I tend to stay up too late.
Yeah.
But I was more of a bulk eater, and I think I talked to Dr. Smith and said, you know, if I felt like my off switch was at the bottom of the tank instead of the top. So I like to feel full. I do feel full now. So when
Yeah.
I feel full, I quit eating.
Now,
great.
one of the things that we've talked about, Eric and Dr. Eric, is that people's progress after the operation with the support team, and everyone does it slightly differently, correct?
Sure.
Why is that so important to find what works for you?
Well, everybody's different. Everybody has different triggers. They also have different weaknesses.
Yeah.
And that's why it's so important, the team that we have that can identify those things. You know, I tell people all the time, I think my surgery will make your life better, but my surgery will not make life's trials and tribulations go away and all the challenges. And so the patient has to be willing to reach out when they struggle, because it's normal to struggle. If it was easy, they wouldn't be coming to us.
Yeah.
And then we have the team that can help them through that, whether it be eating late at night, having bad snacks, not being able to exercise, and finding something that works for them.
What did you do for your maintenance? Exercise, all those sorts of things.
So I kind of did a little bit different than everybody else, I think. The first week, I had surgery on a Monday. I was home on Tuesday. By Thursday, I was walking a mile. By that next week, the end of the week, I was walking 2 miles, and I'd started with a personal trainer.
Right.
So I stayed with a personal trainer. I got in the gym, and I kind of became a gym rat. It was kind of a new culture for me, something I'd never done before. Started running, started exercising, being fit.
Are you off your medications?
Type 2 diabetes is gone. High blood pressures are resolved. Also, I have sleep apnea. That's on its way out. It's a life changer.
And I was about to say, how do you feel every day now?
I feel wonderful.
The men sitting at home watching
Yeah.
you going, oh, I'd never do this. Because we've talked about this before. Men are the last ones to think about going and considering
And I
something
was absolutely
like
on
this.
the boat, providing for the family, you're the last one to think about yourself. When my weight took me to the point where I couldn't do something that I wanted to do, I'd always been proportional, I'd gotten away with it. But when I didn't get away with it, it was over, I was done.
And it creeps up. You don't
It
even
does creep
notice
up.
it, right?
Yeah, absolutely. You know, you don't wake up one day and just notice it, but before you do, you notice, how have I missed this for
You
the
get a
last 2 or
glimpse
3
in the
years?
mirror, or when you're not thinking about it, then you go, oh my goodness, I just look a hot mess
Right.
for me.
And it never gets better.
It
It never gets better. You never lose weight.
Best
You
thing
never-
you've
you
ever
try,
done?
but it never gets better. So you have to make a change.
Best thing you've ever done?
Absolutely. I stand in line and get it done again.
Great team, huh?
Absolutely.
They're the best. Appreciate you coming in, Eric.
Yeah, thank
we
you.
appreciate you as well, Dr.
Yeah.
Eric. If you want to find out more information, maybe you could be the next one to put your best foot forward and allow Georgetown Bariatrics and Advanced Surgical Services help you start a brand new life.